Hello everyone, I'm Dr. Sagir Sheikh, and in this video I will be telling you about some important topics of pharmacology and how you can study pharmacology. In Jan 2023 exam, there were 19 questions from pharmacology. So what are the important topics in pharmacology? First, the antibiotics. Antibiotics, you have to study the general antibiotics characteristic, and then you can proceed with different antibiotics, the uses, the side effects. In autonomic nervous system, the concepts are very, very important. The parasympathetic, sympathetic, the what are the blockers, different beta blockers, alpha blockers. Because one question came from vasomotor reversal of Dale, which is physiology from autonomic nervous system. Corticoids, what are the anti-repituitary hormones, some anti-repituitary hormones, because it will be easy to understand endocrinology from medicine. From hemodynamics, you should study antiplatelets, anticoagulants, and anticoagulants, and fibrinolytics. From fungal and from fungal, some fungal drugs and anti-malarial is very important. General pharmacology concepts, the phases of clinical trials, from kidney diuretics, and from local anesthesia, all the drugs. If you study local anesthesia drugs properly, it will be very easy for because the anesthesia the drug part is completed from pharmacology, and you have to remaining study the general anesthesia, simple anesthesia topics. From NSAIDs, there were topic gout very important. There were some questions from gout NSAIDs. So in whole, this is the important topics which you need to study. Now I will tell you how you should study for pharmacology. I will start. I will go. I will explain cardiovascular system, and you can go. You can follow the same for all rest of the rest of the topics. I will tell you how I used to study pharmacology. For me, cardiovascular system is very important because I like cardio to study about heart. So what I used to do is first I used to go with the cardiophysiology, the action potential, the pre-potential, what is actually pre-potential, and different classes, different phases. So if I know the phases and classes, it will be very easy to understand where the drugs are acting and what is the mechanism of action and how I can remember in exam or for clinical practice. I will give an example of how I remember classes. There are five classes, actually four classes. So how I remember is I use mnemonic. Na beta kal chalo Mumbai. So this was give as a first class for sodium blockers, beta, and the potassium channel blockers. In this way, I used to remember different classes. After the classes, how I used to remember the drugs. What actually I did is, for example, in class one, there are three classes: class 1A, class 1B, and class 1C. So what I did is I just remember the mechanism of action of class 1A and then the drugs. In drugs, I used to study what are the uses and what are the side effects. Only the and some special characteristic. For example, in class 3, there is a drug which is known as amiodarone. It has a special characteristic which is a disadvantage. It increases iodine, so it causes hyperthyroidism, pulmonary fibrosis. So some important special characters they used to ask in exam. So you should be prepared for special characteristic, the uses and their side effects. In for arrhythmia, they have given me a proper table, how you should also make a table. It is very easy to remember for clinical practice as well as for exams, like for atrial fibrillation, what we are using in acute therapy, what we are using in chronic therapy, and for example, there is wide ventricular fibrillation, what we are using in acute therapy, lignocaine, and what is the treatment of choice, that is cardioversion. So it is really helpful in for further, like for medicine subject. If you study pharmacology properly and pathology, there is no need, I think so, there are no needs for the same topics to study from medicine. That's why pharmacology and pathology makes a basics and very important subject to study. There came this time an exam and a question which were on what is the action of fibrate. The answer was it is acting on peroxisome proliferate activated receptor. It was a question was given like that. On which drug is acting by activating peroxisome proliferator activated receptor alpha. So in this way, they are asking nowadays questions. So you should be prepared with what is the mechanism of action, what are the side effects, what are the drugs, what are the uses, what are the special characteristics. Maybe this time they will be asking which drug causes myopathy and which drug increases the risk for myopathy. So in this way, you should be prepared and your notes should be properly studied. So it will be helpful for your exams. For congestive heart failure topic, You should be knowing all the inotropics, about the digitoxin, what is action, and in dopamine there are different three doses. There are three doses which are given, and which at what dose what action is happening. It is important. These questions come usually in neetpg, and it is also expected to come in the fmg, and I think so it has been already it came. Yeah. And after studying the whole subject properly and then revising, you should go with MCQ solving. The most nowadays just practice clinical questions, and just so remember the notes properly. The questions, if it is one liner, then also you can easily solve it. And if it is they have given clinical, then also you can sort of solve it if you know the notes properly. For example, over here there is clinical questions given, and you have to understand the ECG and what is the drug. You can directly solve this. It is as an amiodarone, but there are different options, and it is confusing. So you should know what exactly the question asking and how you can solve this question. So that's why you should need to increase your practice daily, clinical MCQ practice, MCQ daily, MCQ practice. In this way, you can solve and study pharmacology, the different subject, different topics. For example, antibiotics. In antibiotics, you can go with first understand the general characteristics. What if you understand the general characteristics? It will be very easy to understand further the different drugs, different classes, different everything you can understand if you first understand the first subtopic. If you know the first subtopic, what is the general characteristic, which drugs are acting on which thing, so it will be easy to understand further subtopics. For example, the different drugs, the different actions. So that's why it is important to first main go through the basics of the first of the subtopic, the basic first topic, and then the remaining. There came one question was from vasomotor reversal of Dale from modern nervous system. What is vasomotor reversal of Dale? There was a physiology question. So if you study pharmacology properly, so you won't be in a tense to, like, you will be missing out the physiology, because pharmacology is a combination of physiology and medicine and some pathology. That's why pharmacology is important. You just go with deeply with after going to the notes, going to the video lectures, go to the textbook and understand the concept. That's why main focus on concepts. And if you want to remember your pharmacology properly, you have to do revision every month or every 3 months. And before exam, for sure, before 2 days exam, you have to remember, you have to study once again pharmacological drugs and their concepts. And in this way, you can study different subjects, different topics. And if you like this video, thank you for watching.